Hello dear viewers. Today I will teach you antifungal agents. That is Echinocandins antifungal agents. So if you remember, we have already talked about the different antifungal agents and their pharmacokinetic and pharmacodynamics. In this class, especially the echinocandins antifungals, so they are further divided into three groups. The first one is Caspofungins, Micafungins and Anidulafungins. Therapeutically are therapeutic actions that reside in beneficial actions of echinocandin antifungal. They are responsible to inhibits or it cause inhibitions of glucan synthesis. Clinically, the echinocandins antifungals, they are indicated for the following conditions like the treatment of candidemia and other forms of infections. The treatment of invasive aspergillosis and patients who do not respond or are intolerant to other therapies. Prophylaxis of candida infections and the patient with hematopoietic stem cells transplant. This group of drugs, they are contraindicated, and the following, they are contraindicated for the use of antifungal, like for example, Anidulafungin. So Anidulafungin is, it may cross the placenta and enter into the breast milk. So it should be used with precautions, with caution, which is also used, and the presence of hepatic impairments. Another one is Caspofungin. So it is embryo toxic, and animal studies in known to enter in the breast milk. The adverse effects which are reported after administration of these agents, so the use of echinocandins antifungal may result to these adverse effects, which is the obnoxious or unpredictable reactions which is occur due to overdosing. So GI gastrointestinal hepatotoxicity may occur, serious hypersensitivity reaction, particularly with Micafungins, while an immunological condition like bone marrow depression. So this is also the major adverse effects which are reported by the echinocandins. Other antifungal agents, they are also used. For example, amphotericin B, flucytosine, and gracefulvin and nystatin. So all these are antifungal agents. Therapeutic actions or clinicals, you can say indication at causing the fungal cell death and preventing the fungal cell reproductions. You can see here on the screen amphotericin. So you know amphotericin, actually the exact mechanism of action of amphotericin. So it can bind to the sterol, which is the main components of the compounds, especially the chemicals, substance which is responsible for a certain type of fungal infection. So these antifungal agents like amphotericin B, so it can bind to the sterols, especially in the fungus cell walls, by changing the cell wall permeability, and it is very potent drug with many unpleasant adverse effects. While the second one is flucytosine. So this is another antifungal agent. So this is less toxic drug that change or they can alter the cell membrane of susceptible fungi, which causing cell death. So gracefulvin acts in much the same way. While another agent that is called nystatin. So nystatin, it can also bind to the sterols, or you can say ergosterols. So nystatin, it can bind to the sterol and the cell wall by changing the permeability and allowing the cellular component leakage. Come toward the pharmacokinetic profile. of antifungal agents. So these agents are poorly absorbed orally. These agents, so they are insoluble in water, so colloidal suspensions may be prepared with sodium deoxycholate and the ratio of 1:1 complexes. 90%, so it is bound to the plasma protein, while these agents it can be metabolized and the liver slowly excreted in urine, while the half-life of this drug is 15 days, mean it can achieve the peak plasma concentration within 15 days, and after that the concentration must be reduced 50%, half of its original concentration. Okay, so this is also very important, especially in clinical point of view, whenever you are going to diagnose a patient. So these are the contraindications. The following, they are contraindications for the use of other antifungal agents. Let's suppose amphotericin B, so it is successfully used during pregnancy, but caution must be used. It means that there are certain antifungal agents which are contraindicated. It cannot be used in pregnancy, while amphotericin it can be used during pregnancy, but it should be used with precautions, and this is contraindicated during lactation because it can cause potential risk in neonates, especially a newly born baby. Another one is plocytosine. So plocytosine is another antifungal agent. This is extremely contraindication in a patient with renal impairment. For example, a patient who is suffering from renal failures or renal impairments, and so it can cause toxicity. Toxicity can be occurred at 100 microgram per ml. Nystatin is another antifungal agent which cannot be used during pregnancy and for lactating patients because it can affect, they are not still knowns, they are still unknowns. While the adverse effects which are reported here, you can see all these factors, especially like that adverse effect, the use of other antifungal agents may result in these adverse effect. For example, in acute events, acute reactions may be occur in the form of chill, fever, headache, pain, all over, nausea, vomiting, and dyspnea, lasting 3 to 5 hours because of release of interleukins and TNF. It can be treated with hydrocortisones, which is corticosteroids, at the dose of 0.6 milligram per kg. The long-term toxicity may be nephrotoxicity, azotemia, and hypokalemia, acidosis, and anemia-like conditions. And CNS and central nervous system and CNS toxicity, it causes intrathecal administrations. So after intrathecal administration, headache, vomiting, and neuroparalysis palsies may be occur. Hepatotoxicity, they are rarely reported by the literature. You can see here the site of actions, how these antifungal agents can show their pharmacological activity. So first of all, these antifungal agents, so the first one is L-ilamine. So L-ilamines actually, it blocks the ergosterol formations in the cell membrane by the inhibition of squalene epoxides. In case of polines, it can bind to and disrupt the cell membrane of the bacteria. While the third one is azole. So azole is also another antifungal drugs. So the exact mechanism of action of azole, it can block the ergosterol formations in the cell membrane while inhibition of cytochrome P4 peptide dependent 14 alpha D methylase. Now what is P4 peptide dependence? So you can watch my lecture number 103, so you can watch it. So this thing, it will be easy for you peoples. Caspofungin. So caspofungin is another antifungal agent which can block the intracellular microtubules, while plocytosine, which is active uptake via permease, it blocks the DNA and RNA synthesis. So this is very simple mechanism, so you can memorize all these things by fingertips. Okay, now come to our topical antifungal agents.